Again, you do not need an appointment to go to the Alamo Dome Tuesdays through Saturdays, 9 a.m. to 6:30 p.m., and those vaccines are free of charge. If you prefer to make an appointment, we will open 10,000 more Alamo Dome vaccine clinic appointments this Sunday at 2 p.m. Visit covid19.sanantonio.gov to register for one of those appointments. Tonight, we're reporting 341 new cases of COVID-19, which brings our total to 217,219. Our 7-day rolling average is now at 235. A reminder that, again, COVID-19 is still circulating in our community as we continue to get folks vaccinated. So please get vaccinated to help us end this pandemic and do your part, such as mask wearing, social distancing, and proper hygiene to protect others and yourself from the virus in the meantime. Fortunately, we do have no new deaths to report tonight. Please keep our neighbors and friends and loved ones who have lost loved ones in your prayers this evening. Over in our hospitals, we've seen a couple days of downturns in the hospital numbers, which is good news. There are 240 COVID-19 patients in local hospitals tonight. There are 21 new admissions in the last 24 hours. 67 patients tonight are in ICU, and 44 are on ventilators with COVID-19. Now, on to Commissioner Clay Flores for an update on the county.
Thank you, Mayor. I'm County Commissioner Rebecca Clay Flores. To date, Bexar County Hospital UHS has administered a total of 388,321 vaccinations and 14,000 doses this week. Our Wonderland Crossroads site is continuing to accept walk-ins every single day. As the mayor said, hospitalizations today are at 240. But if you consider that a month ago, only 30 days ago, we had 192 people in the hospital, which means that 48 more people are in the hospital today than were in the hospital a month ago. People still need to get vaccinated, yet the vaccination rate is slowing down. Many Americans are choosing not to get vaccinated. I saw in Good Morning America today that there are many vaccines that are going to expire. Yet there are countries like India that are being ravaged by death. And I have cousins in Mexico who still can't get vaccinated because there's not enough for our age group. We are privileged Americans, and we can choose to get vaccinated. We even have options to choose from, 3 different options, and they are all free. I've had to get several vaccinations over the last years because of different countries that I've wanted to go to, and they can be quite expensive. I said early on that I didn't think it was fair for me to get a vaccine just because of my position as county commissioner until older adults and people with underlying health conditions in Precinct 1 got their vaccines first. Now that most people in those categories have been vaccinated, I am choosing to take the one shot, Johnson & Johnson, on my birthday, Cinco de Mayo. And I invite you to come out and get the one shot and get it over with and celebrate Cinco de Mayo with me at the Bexar County Hospital UHS Clinic on the south side at 4503 South Zarzamora from 11 to 2 next Wednesday. Come by during lunch, go in, get your one shot, come out, show your vaccine card. We will have tamales for you. We will have mariachis. You can set up an appointment by calling my office at 210-335-2611. Come celebrate Cinco de Mayo with me. I want to travel again. I want to hug my mother again. So please come join me. Choose to get vaccinated. Get your one shot on Cinco de Mayo. Thank you.
Thank you, Commissioner. And as you know, we've been getting a lot of questions to Metro Health Department, our health professionals here at the city. And so every briefing, we also want to ask one of those questions on the air in case that question is on your mind. So I'm going to pose this one to Dr. Espinoza. How do we know that vaccines are safe? Could they cause long-term problems?
If we look at the history of vaccines overall, we've never seen any severe illness or long-term consequences. So right now the research is showing that there's no evidence that having the vaccine will cause long-term harm to individuals. We are very aware of all the short-term side effects that last anywhere from 24 to 48 hours, some as long as 72 hours, but those all seem to resolve. So again, just to encourage individuals to go get vaccinated, not only to protect yourself, but to protect those individuals that cannot be vaccinated.
And thank you, Doc. And as the Commissioner said, that is the way, the one sure way we can get back to the things that we used to enjoy prior to this pandemic beginning. As always, you can get the latest on COVID-19 in our community by texting COSA.gov to 55000 or by going to the website covid19.sanantonio.gov. And also, if you are struggling through this pandemic paying rent or mortgage, know that there is housing assistance available for you. Get more information by calling 311. Also, if you're out of work and without income and would like to train for a job that is available today in our community that pays well, you can enroll in our training program. While you receive a stipend to make ends meet, you can call 210-224-HELP to enroll in that training program. And again, the latest on COVID-19 by texting COSA.gov to 55000. And thank you for continuing to do your part to protect yourself and loved ones from this disease. Continue to mask up, practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. The Commissioner, myself, and Dr. Espinoza are available for questions.
Commissioner, Judge Wolf said earlier this week that allegations of child abuse of migrants at the Freeman Coliseum were completely false. Do you agree? And if so, how do you know?
So I absolutely agree with the judge. The judge and I stand by the facts, and they haven't brought evidence to negate that, so that's how we know.
Do you have any new information to share or any updates about the situation and the investigation?
No, I do not. As you all know, it was the governor who brought forth those allegations, so it's up to the governor to follow up and bring forth the evidence.
That's all we have tonight. Thank you.
Thank you.